Today I'm going to show you some nail changes which can identify when somebody became ill. There are three different kinds of nail changes which we can see in patients who have become ill in the past. One of them is called as the Mees lines, the other one are the Beau's lines, and we can also have a longitudinal bridge as well. I've got a patient who had acute kidney injury a few months ago, and that was because of dehydration plus infection. Her creatinine has improved, but that has left some changes on the nails. This is the right hand, and in the right hand we can see that there are these lines, which you can see that these are longitude, these are lines which are going across the nail. Now these lines are in the nail plate. They are not palpable otherwise, and these are called as the Mees lines. Um, as you can see that these are very well demarcated lines. You've got a white area, and then after that you've got a dark area, and they are very evenly placed. And they tell you about if you can calculate, they would tell you how long ago somebody was acutely unwell. The nail changes on the left hand are the ones which are called as the Beau's lines. Now this is interesting because we've got two nail changes in the same patient. On the right side we've got the Mees lines, on the left hand side we've got the Beau's lines. And if you can look here closely, you can see that there is a ridge on this particular finger, and this is a palpable ridge. So these are the Beau's lines on the left side, and then we've got the Mees lines which are on the right side. Along with that, which is probably just an incidental finding, is what I see here on the thumb, and this is a longitudinal line. This is not associated with any illness, but this just tells you that there is increased melanin deposition in the nail. It may or may not be associated with anything, but whenever the nail will grow, it will continue to have this particular line. Importantly, if you want to time it, if you want to find out how long ago somebody had these nail changes, the nail grows at a rate of 3.4 millimeters per month. So in other words, from the time that it takes the nail to come from here all the way till up here, it takes about 6 months. So if this patient had these Mees lines and the Beau's lines obviously, then what that means is that she became unwell somewhere within the last 6 months. And you can see from this particular line that this is a very recent one. So that means that she was unwell perhaps a couple of months ago. And this way you can tell when the illness occurred. Thank you.